Okay. Bismillah ar-Rahman ar-Rahim. Tonight we will solve together the questions from chapter Quality Basics. So, okay, Doc Nadim, these questions are based on the old Janet book system, which classified them under the Quality Basics chapter. However, as we will discuss the Quality Basics chapter, this essentially offers snippets of from the broader curriculum we are studying. So that's why you will notice that today's questions are more comprehensive, covering the entire curriculum rather than just the quality basics section. So I don't want you to feel overwhelmed or worried, because there's no need to be afraid of or think these questions are too difficult. On the contrary, these questions and the topics we will cover, whether we have already studied them or will explore them in the future. So we'll feel much easier after this session, inshallah. So don't worry or feel that the material is too challenging. It will all become manageable. So the key is to focus on understanding the explanation of the questions as we go through them together. Okay? So Bismillah ar-Rahman ar-Rahim, let's get started. The first question is, the appropriateness of care is, okay, hold on. A, primarily a focus of utilization management. B, a key dimension of quality care. C, equivalent to case management. D, the degree to which healthcare services are coherent and unbroken. So what's your answer, Doc Nadim?
It's the key dimension of quality care.
Okay, appropriateness here refers to what? One of the key dimensions of quality that we have studied earlier. So this is correct. You are correct, Doc. Appropriateness means providing a medical service. Yes, Doc? Appropriateness means providing a medical service that aligns with the patient's needs based on their medical condition and clinical status. So, for example, Dr. Nadim, if a patient comes to the ER requiring CPR, but instead, we suggest extracting a decayed tooth or referring them for a dermatology consultation. So that would be inappropriate, right? So appropriateness ensures that the medical service provided is directly suitable for the patient's condition. So intervention must match the medical necessity. So the correct answer is B, a key dimension of quality care. Very good, Doc. So next question. A medication is ordered for a diabetic patient. Its capacity to improve health status as a dimension of quality or performance is, it's A, effectiveness, B, potential, C, appropriateness, or D, efficacy. What's your answer, Doc Nadim?
It's efficacy because it's asking about the capacity.
The capacity. So what's your answer?
Efficacy, D.
D, efficacy.
Yes.
Okay. So
C,
you are
appropriateness.
correct.
Yeah, correct.
Sorry, Doc. What's your
We
answer?
have Dr. Radha
Oh,
also, or Sister Radha, want to answer with you also.
Oh, mashallah. Yes, you're welcome, Doc.
Thank you.
So what's your answer, Doc?
No,
You
it's
have answer one.
for a diabetic patient capacity, dimension of quality of performance is efficacy.
Efficacy. Mashallah. Ro'a. You are both correct. The answer is efficacy, because efficacy means capacity also. So capacity together and agree that it refers to to capability. So when we talk about the this efficacy, it's the ability to provide services or resources. So the feature is this capability. The meaning of efficacy, or the another word is capacity also. Okay. So that's it. That's the correct answer. Okay, let's move on. Next question. That dimension of quality performance that is dependent upon evaluation by the recipients and or observers of care is A, respect caring, B, safety, C, continuity, D, availability. So in here, we are talking about an evaluation of the recipients. That depends assessing the experience of the service recipient. So do you remember when we discussed the dimension of quality? Yes. So one of them focuses. One of them
Safety.
focuses. Yes. What's the answer, Doc?
Safety.
Safety. What about Dr. Nadim?
Respect and caring.
Respect, caring. Okay. So I just want to continue my explanation. So as you remember what we discussed, the dimension of quality. So one of them focuses on the map. So this measures, we have the map, the 3 aspects of quality. So we have here measurable, appreciative, and perceptive. So which allows us to assess, review, and ensure compliance or conformity. So this means that MAP ensures the service delivered aligns with the patient's needs, ensuring satisfaction. So this is part of the aspects of quality related to respecting the patient's experience and involvement. So in here, it's addressing one of the key dimensions. Okay? So, which includes the respect and participation. Okay, respect and participation, these elements rely on the patient's feedback and evaluation of the care provided. So, for example, did the medical service treat the patient with respect? Was the patient allowed to participate in the decision-making process and understand their condition and be informed about the treatment steps and protocols? So which dimension of quality is evaluated based on the patient's feedback? So the answer is?
Respect and caring.
Very good. So the answer is respect and caring. Okay, you both get correct answer. Mumtaz. Okay, 4. If in the continuous quality improvement process, so we decrease our emphasis on customer satisfaction and outcomes of care. So which 2 dimensions of quality performance must be incorporated into all quality management activities? So we have A, availability and respect caring. B, respect caring and competency. C, effectiveness and respect caring. D, continuity and competency. So here it's asking about the methodology. If we increase the focus, so it means we are connecting into it. So what? Which 2 dimensions? What do you think? What's the answer here? So what is the link between these dimensions? Can be A, B, C, or D.
Okay.
Which letter? Letter B for you, Doc Nadim?
C. Effectiveness and
B, respect caring.
C. Yeah. C.
Okay.
Effectiveness.
Okay,
and
what about you, Do?
Yes, same. Effectiveness and respect caring.
Okay. MashaAllah, tabarakallah. Yes, bravo. So the correct answer is C because it links activeness, which involves customer satisfaction. So the customer satisfaction as the outcome. So this means that it focuses on achieving outcomes through effectiveness, which ensures the service provided meet the needs and expectations of the customer, so leading to satisfaction. Okay, so by linking these two, we are achieving alignment between the customer satisfaction and effectiveness. So where satisfaction is considered the ultimate outcome. Okay? So any question regarding this? We will move on. Okay,
Move on.
next. Number 5, which of the following key healthcare issues is more problematic for ambulatory care than for inpatient care? So when we say ambulatory care, these are the outpatient care facilities or centers. So letter A, reimbursement for care. B, access to specialty care. C, appropriateness of treatment setting. D, quality of care provided. What's the answer?
There is problematic. Ambulatory care.
Ambulatory meaning the outpatient.
Yes.
Okay, so what are the issues that occur in ambulatory care facilities? Problematic for ambulatory care. These are the outpatient centers, such as the primary care facilities, where there is no patient admission. So these centers often face several issues regarding the quality of care. So first issue to address, the patient's medical file is scattered. So what does that mean? For example, the patient visited one healthcare provider today, and their medical history is recorded in the provider's file. Later, they visit another healthcare organization, which is the provider B, for chronic conditions such as hypertension or diabetes, and their medications are logged there. Then, if the patient experiences joint pain and visits an orthopedic specialist, which is the provider C, their new treatment details are recorded separately. So later, the patient visits provider D for gastrointestinal or other specialties. The result is that their medical file is fragmented with no central record containing all their data and medical history. So that's the first issue. What's the second issue? Patient-controlled medication. So for instance, as a healthcare provider, you give the patient instructions about their medications like diet and care plan. However, since the patient is not admitted to the hospital under continuous medical supervision, you don't know if they're following your instructions correctly at home, right? So this is the second issue. The third issue is access to specialties. When patients feel unwell, they often self-diagnose and decide which specialty they need. For instance, a patient experiences shoulder pain and assumes it's a bone issue, so they visit an orthopedic specialist. However, the pain might actually be related to gallbladder inflammation, so which can cause referred pain in the upper back. So instead of addressing the root cause with imaging like an ultrasound, the patient might end up receiving irrelevant treatment. So patients often skip family medicine, which could guide them to the appropriate specialty. So this is a major issue with access to specialties in ambulatory care. So these problems don't typically occur in hospitals when patients are admitted. So when inpatients are under your control, the care team determines which specialty consultations are needed based on the patient's condition. So now, what's the correct answer here? Doc
C.
Doc? What letter?
Is it access to specialty care? By the way you have explained, probably it's access to specialty care, but I still doubt between B and D.
Okay. So who answered letter C?
Me.
Okay, because
It's
the
B,
correct
access to specialty.
access to specialty
But
care.
I doubt between B and D also.
Okay. So the best answer here is letter C, appropriateness of treatment setting.
Okay.
Okay, so it's discussing the issue related to access to okay, wait, hold on. Okay. I'm sorry. I
B.
overlook
B.
it. The answer here is letter B. Access to specialty. Okay. Access to specialty care. Yes, you are correct, Dr. Nadim. Yes. Because this is one of the first issue. Okay. Bravo. Next, number 6. Incorporating the TQM key concepts, compartmentalization of QI activities by organizational structure like department or discipline is A, a weakness in implementing quality improvement, B, the most efficient structure, C, consistent with TQM philosophy, D, important for preservation of medical staff autonomy. What's the answer? Okay, so what is to consider? It asks when I apply a program that focuses on a specific department or area instead of the entire system. So what do we call this? So for example, if we want to focus on the laboratory section and make it independent, working on it as a separate entity without integrating it with the other departments. So what would this be considered?
It goes against TKM philosophy. So option A, weakness in implementing quality improvement, I guess.
Okay, what about you, Doc? Yes, that's your answer, Dr.
The
Nadim.
same, a weakness in implementing quality improvement.
Bravo to you all. This is considered a weakness because, yes, the answer is letter A, a weakness in
can't-
implementing quality improvement. Very good. Okay, because this one, as we agreed, that more perspective in quality management means that improvement should be cross-functional or cross-departmental.
Departmental.
Very good. Next, one fundamental difference between monitoring product quality and service quality is based upon the fact that A, a service is easier to measure and verify in advance. B, a service is not perishable. C, a service more heterogeneous than an object. D, there are more service delays than product delays. So in here, the question is asking about the difference between product and quality and service quality. So let's review the difference between product and a service. A product is a tangible item, so something you can hold in your hand like cell phone. So in the other hand, a service such as medical care provided to patients is intangible. Okay. So you'll notice that products can be mass produced, like creating 1,000 or even 1,000,000 identical products from the same product line. However, services are. So what's the answer?
C, service is more heterogeneous than an object.
Okay, very good. The answer is letter C. A service is more heterogeneous than an object. Services are heterogeneous, meaning the service I provide to one patient today cannot be exactly the same as the service I provide to another patient, right?
Yeah.
Understood? Okay, so let's move on. Next, the quality professional can best facilitate the development of a quality culture in an organization by A, assessing the organization's readiness to commit to change, B, designing a long-range plan for cultural transformation, C, encouraging leaders to commit to a culture of excellence, D, leading the cultural transformation redesign team. So how do we go about this? It is as if they're asking us how to guide the process and aim for a clear transformation. So, okay, what's the answer? What is
Is
the
it
quality
C,
culture?
encouraging leaders coming to
Okay. As I mentioned before, the first and most critical step in any improvement initiative is always leadership commitment. So what's the answer? Okay. Is it A, B, C, D?
C?
Okay. It's letter C. Encouraging leaders to commit to a culture excellence. Okay, bravo. So the correct answer here is indeed leadership commitment. Okay, this is the reason. Okay, let's move on. Number 9. The task of setting up an ambulatory care setting, QM or QI program, quality management or okay, the QI, quality improvement program that focuses on outcomes as a measure of treatment effectiveness is difficult because A, the patient remains in control of treatment. B, patient care outcomes are determined by the payer. C, there are no required medical records. D, expected outcomes for ambulatory conditions too obvious. So this part also seems like it's asking about the problems we face in the ambulatory care. So what are the issues we mentioned earlier? So the insurance company, this isn't something we need to consider here, okay? In here, we said that there are three main issues. The first problem is the scattered medical file. The second is the patient-controlled medication. And the third is the access to specialties. So which one should the answer be? What's the answer?
A.
D.
Patient remains.
D.
Sorry, what's the answer, Doc?
A. Patient remains in control of treatment.
Very good. Okay, the answer is the patient remains in control of the treatment. Yes, that's the correct answer. So what about why not the other options like B, C, and D? Because for the B, patient care outcomes are determined by the payer. So
No.
this is irrelevant in this context. While payers, example, insurance companies, influence healthcare policies and funding, but they do not directly determine the individual treatment outcomes. Yes. For the letter C, there are no required medical records. This is incorrect because medical records are
There is
indeed,
scattered.
yes, because these medical records are indeed required and maintained in ambulatory settings, even if they're sometimes scattered across different providers. While D, it is incorrect also because expected outcomes for ambulatory conditions are too obvious. So this is incorrect because the difficulty lies in measuring these outcomes, not their clarity. So in fact, outcomes in ambulatory care can be highly variable and complex to assess due to patient autonomy. Okay, so let's move on to question number 10. The quality management cycle based on Duran's quality trilogy, which are the quality planning, quality control, and quality improvement. Letter A excludes the lab's activities to monitor equipment. B requires a departmentalized approach to quality management. C encompasses only the non-clinical aspects of QM. D incorporates information from strategic planning. So after this, the best answer here is what? This is about the continuous improvement. So this focuses on the fact that any improvement we make goes through the three phases: the quality planning, quality control, and the quality improvement. So what's the best answer here?
D. Incorporates information from strategic planning.
Any other answer? Any other?
No, it is the same. Strategy, planning, strategy.
Okay, the correct answer here is letter D. So this incorporates information from strategic planning. Very good. So as we agreed that any improvement or development must align with the strategic plan. So the improvement should be consistent with the organization's strategic goals. So the correct answer is about aligning improvements with the strategy, ensuring they fit the overall goals of the organization. Okay. Next. Okay, the perception of quality by a patient receiving care in an ambulatory healthcare center is influenced most by A, the physical environment, B, caring staff and physician, C, new technology, D, physician's technical competence. What could affect the quality of medical services provided to the patient? Any answer now?
Caring,
I guess it's
okay. Caring.
What's the answer, Doc?
the caring staff and physician.
Yeah.
Oh, mashallah. Bravo to both of you. So the correct answer is that the key factor influencing this is the relationship between the medical service and how
And
it is
physician.
delivered. So answer is B, caring staff and physician. So the perception of quality in an ambulatory healthcare center is heavily influenced by the connection between the healthcare service and the way it is delivered. So this aligns closely with the factor of caring staff and physicians, as they are central to how care is provided and experienced by the patients. Okay, any question? Okay, so let's move on. Next question. Total quality management philosophy assumes that A, most problems with service delivery result from systems difficulties. B, frequent inspection is necessary to improve quality. C, most problems with service delivery result from difficulties with individuals. D, top management leadership in quality activities. These, what is this? These franchises employees. So what's the answer?
Most profess A.
Okay.
Most problems with service.
Very
system
good.
difficulties.
Okay, the answer is A. Most problems with service delivery results from systems difficulties. Okay. Very good, the both of you. Okay, so why the answer is letter A? So most problems with service delivery results from system difficulties, meaning, so the philosophy of the TQM emphasizes a systematic approach to improving quality. So it assumes that most issues in service delivery arise from system level deficiencies rather than individual shortcomings. So I am emphasizing the importance of investigating the root causes systematically rather than blaming individuals. Yes. So that's the reason. Okay, next. A potential conflict between the philosophy of total quality management and quality improvement in healthcare is the challenge in Deming's principles to A, eliminate numerical goals for management, B, cease dependence on inspection, C, constantly improve every process, D, break down barriers between staff departments.
C.
C?
Challenge in demands.
Any other answer?
1 minute.
So here he's asking about the difference between quality management in the past and total quality management. So what's the difference? So let's recall the difference between these two. We said that TQM says that all departments are interconnected. So when I work on improvements, they should be multidisciplinary. So on the other hand, quality assurance used to be a departmental effort, with each department working separately. So that's the first point. What about the second point? Is that total quality management focuses on continuous improvement, while quality assurance only made improvements when a problem occurred. So when a problem was identified, they would start looking for its causes and solving it. Quality assurance focuses on corrective actions, and it tends to focus on the individual, how the persons did something wrong and what led to the issue. So the correct answers are about what? Focusing on processes, not on individuals, and about continuous improvement. So the best answer is that
C. No?
letter
C.
B,
C.
C.
Constantly improve every process.
No. The answer is B. Cease dependence on inspection. That's the answer. In here, as you can read here, this eliminates the need for inspection on a mass basis by building quality into the product in the first place. In practice, more inspection as far to the beginning of the process as possible. This prevents the defect, deficiency, or any error. So that's the rationale.
Okay.
Okay, clear?
Yeah.
Okay. So 15, what is the most important relationship between structure, process, and outcome as types of indicators of quality? A, interdependent, means structure directly affects both process and outcome. B, causal, structure leads to process and process leads to outcome. C, relational, meaning useful for comparisons but not causal. D, there is no relationship. There are categories used to group indicators.
B.
So what do we need in order to be able to improve? What are the essential components that help us achieve this? So to achieve this, what relationship exists between the
B.
three components? B?
B.
Any more answer?
Directly affect process and
B, causal.
Very good. Bravo to both of you. So the basic components that we need are, so these essential elements form the foundation. So these are the basic things. So I need to order to be able to work and achieve what's required. The correct answer is B, causal. The structure leads to process and process leads to outcome.
outcome.
Very good. Okay. 16. Continuous quality improvement efforts find problems in hospital admission. So to provide breakthrough ideas in admission, the quality team seeks ideas from A, other hospitals, B, previous lecture, C, automobile industry, D, hotel and resort industry.
A.
What should I focus on improving? The hospital process, or should I look into hospitals around me? Or should I look at hotels or resorts? Or perhaps the automobile industry or industries
Yeah.
related to Olympic services? Yes. Okay.
A.
So
Other was
I want to ask a question. When you go to stay in a 5-star resort or hotel for a couple of nights, how do you feel when you leave? You might feel really relaxed, thinking, I had such a great rest. This place is incredibly comfortable. I felt like I didn't want to wake up. So, if I want to improve the hospital admission process, what should I focus on? I should look at the
other hospital.
Mhm. Any other question?
Hotel
Other
resort
answer?
industry for service standards.
Okay.
For hotel and resort industry.
Yes, the answer is letter D. So I should look at the hotel and resort industry and what
How they work.
standards they follow when preparing their rooms to be comfortable. So what factors do they take into account for comfort? Like the mattress, the lighting, and furniture. Why?
Mm.
Because I want to make a breakthrough change in the hospital admission process. So where do I get the best ideas? From those who excel in it, right? You can follow what I mean? So the
Yeah,
answer is
D.
D, hotel and resort industry. Okay. So next, which of the following best describes the successful outcome of the quality improvement process? A, customer satisfaction. B, enhanced communication. C, employee empowerment. D, improved statistical data.
Improved statistical data.
Is it A, B, or C? What does it describe? The quality improvement?
Data. No. Which of the following are described as successful
We as a group are working on improvements within the
outcome?
organization, right? So we'll take, okay, so
What-
any improvement we make, we do it to enhance.
Yes,
So what's the answer?
customer satisfaction.
Yes, definitely. The answer is always customer satisfaction.
Mm.
Bravo. So it's about improving patient satisfaction, or as we could always say, customer satisfaction to make it inclusive. So if someone asks me what the best thing is, then by improving patient satisfaction, that's what I achieve. So customer satisfaction, the successful outcome of the quality improvement process is best measured by customer satisfaction as it directly reflects the effectiveness and impact of the changes implemented. Is it clear?
Yeah.
Okay, very good. Next, number 18. Monitoring the specific organization and content requirements of a medical record system is a review of which focus: A, outcome of care; B, process of care; C, structure of care; D, administration of care.
Outcome of care.
Yes,
Structure of care.
very good. So the correct answer is structure of care. Okay. The medical record is part of the structure. Okay, so this is related to the setup. So you got it all correct.
Correct.
Correct. Yes. Very good. Next. 19. The major difference between traditional quality assurance activities and the expanded quality improvement performance improvement activities is the QI project improvement focus on A, people and competency; B, analysis of data; C, performance measures; D, systems and processes.
Performance measures.
Systems and processes.
What,
Systems and processes.
systems and processes?
PI focus on performance measures.
MashaAllah. So the answer is letter D.
System and process.
Systems and processes. Because the major difference between traditional quality assurance activities and the expanded quality improvement, or the QI, and the performance improvement, the PI activities, lies in the shift of focus from individual performance and inspections to systems and processes. Okay, so this transition represents a fundamental change in how quality is managed and improved. So this shift in focus, noting that quality improvement and project improvement activities prioritize understanding and improving the processes and systems that support performance rather than solely concentrating on individual competency or performance. So that's the reason. Clear? So it is systems and processes. the difference between the traditional QA activities. Okay, it's the systems and processes. Next. Monitoring phlebitis associated with IV insertions by nurses in the surgical intensive care unit addresses which focus? A. Outcome of care. B. Process of care. C. Structure of care. D. Administrative procedure.
Process of care, monitoring phlebitis.
Mhm.
Process of care.
Outcome of care. Okay, it's letter A. Okay, so we need to understand, not just to memorize. So the question asks, when I monitor phlebitis, what are the signs? Sorry, Doc?
Monitoring phlebitis is you are monitoring the process.
Monitoring phlebitis process.
Okay. The answer here is the outcome of care. Because as I said, monitoring is itself a process. Monitoring. Okay. But to keep in mind, we need to understand, not just to memorize. The question asked is, when I monitor phlebitis, and what are the signs? So for example, when the vein becomes bluish or swollen, or when there is a change in color, like the vein becomes blue due to IV insertion. This happens to some people after drawing blood samples or inserting cannula. So during IV insertion, the vein might turn blue under the skin, causing bruising beneath the skin. So this is phlebitis. So the question asks, when I monitor phlebitis, which occurs while I am performing. So a procedure, what am I focusing on? What am I focusing on? So we notice here that this means I am looking at the outcome. Okay, so the nurse is observing what might happen. So as a result of this IV insertion, when I say I want to monitor the effect that occur after IV insertion, what am I focusing on here? Is it outcome, structure, or process?
Yes, sir. Outcome.
Yes, so this is the outcome of care. Okay?
Yeah.
Because it's about what might happen. So monitoring phlebitis associated with IV insertions focuses on the outcome of care because it involves assessing the results of or the effects of a procedure in this case, which is IV insertion. Okay, so while monitoring is part of a process, but the focus in this question is on the effects or the outcome of the IV insertion, which is the phlebitis. Clear? Any question?
So far, no.
Doc Nadim, is it clear to you?
Yeah.
Okay,
Clear
thank
about
you.
it. I was just thinking, when does the answer becomes right?
Okay, Doc. Thank you, Doc. So let's now proceed. 21. The centerpiece of outcomes management in healthcare is A, the measurement of the patient's functionality and quality of life. B, morbidity and mortality. C, data reliability. D, financial impact.
Outcome management.
A measurement of patient's functionality and quality of life.
Okay, the answer is correct. It's letter A, the measurement of the patient's functionality and quality of life. Very good. Why? Because this one is the centerpiece of outcomes management in healthcare is focused on measuring the patient's functionality and quality of life because these aspects provide the most comprehensive evaluation of care effectiveness and its impact on the patient's overall well-being, while morbidity and mortality are valid measures. So the best answer is the one that reflects a broader perspective, which is functionality and quality of life. Okay? Next. Review of the timeliness of high-risk screening for diabetes addresses which focus? A. Outcome of care. B. Process of care. C. Structure of care. C. Administrative procedure.
Which
Process.
out.
Reviewing a timeline, for instance, when you conduct a review of the timeline or when you're asked about timing, remember this is a rule. Anything related to the time taken to complete particular task is considered what?
Process measure.
Process of care.
Process of care, letter B. Yes, this is the correct answer. Reviewing the timeliness of high-risk screening for diabetes focuses on the process of care as it evaluates how efficiently and effectively a healthcare service is delivered. So anything related to time or timeline is considered part of the process because it reflects how care is delivered, not the resources used like the structure or the results achieved as outcome. Okay, so the correct answer is process of care. Very good. Next. Under the quality improvement paradigm, which statement is incorrect? A. The focus is on the competency of individual practitioners. B. The focus is on the efficacy and effectiveness of processes. C. The focus is on the patient. D. The focus is on organization performance.
And
A.
improvement of paradigm. Which
This is
statement
on competence.
incorrect?
Okay, what answer?
Is not the problem.
A.
A.
Okay. Okay. The correct answer here is A. The focus is on the competency of individual practitioners. In the
No.
quality improvement paradigm, the focus shifts away from individual blame or competency and instead emphasizes processes, patient-centered care, and organizational performance. So the focus is not on individuals. The purpose of QI is to shift away from a blame-based culture and instead address the root causes of problems within the process or the systems. Okay? Clear?
Clear.
Okay, so number 24, within the context of total quality management philosophy, communication of quality is A, the responsibility of top management leaders, B, delegated to the quality management department, C, an internal organization, not community issue, D, independent of process, budgets, or cost.
Quality management philosophy.
A. Responsibility of top
Quality
management.
is top management.
Okay, very good. Bravo. So the answer is A, the responsibility of top management leaders. So in the context of the total quality management, the communication of quality is primarily the responsibility of top management leaders. Very good. TQM emphasizes leadership commitment as a foundational element for achieving and sustaining quality across the organizations. Okay? Clear? No question?
No question.
Okay, no question. Let's proceed. 25. The probability that each step in a process will occur as it needs to occur is known as A, predictability, B, reliability, C, dependability, D, consistency.
Reliability. Reliability. Probability.
Consistency.
Letter? Okay.
Consistency. D.
The correct answer here is reliability, letter B. The probability that each step in a process occurs as it needs to occur is defined as reliability. What is reliability? This refers to the consistency of a process or system to perform as expected each time it is executed. Each step in a process will occur as it needs to occur, is known as reliability. So it ensures that every step in each step in a process happens correctly and produces the same result repeatedly. So reliability is achieved when every step or process yields the same outcome, reinforcing trust in the system's accuracy and predictability. So I want to give an example. In a laboratory setting, if a blood test is performed multiple times and consistently yields the same result, the process is considered reliable. Very good. So that's the meaning of reliability. Clear?
Yeah.
Doc Nadim? Any doubts?
Yeah, clear. Clear.
Okay,
No
thank you.
doubts.
So let's proceed. Organizational culture most often refers to A, the ethnicity of the organization's employees and licensed independent practitioners. B, assumptions about people and how work gets done. C, the efforts to reach out to diverse groups in the community. D, the scheduled social and cultural events within the organization. What's
B.
the answer?
The assumptions and how work it. B.
Okay, the correct answer is letter B, assumptions about people and how work gets done. Okay, so why not the other options here? What about the letter A? The ethnicity of the organization employees and licensed independent practitioners. Because while diversity and ethnicity are important aspects of organization, they are not what defines its culture. Culture is about shared behaviors and values, not the demographic backgrounds of the employees. What about letter C? Okay, community outreach efforts reflect on an organization's community engagement strategy rather than its internal culture. So culture refers to how work is done and how people interact within the organization, not externally. So letter D, okay, while social events contribute to building relationships, they are only a small part of culture. Culture is much broader, focusing on assumptions and shared values that drive day-to-day operations. So the culture is about how work is performed and how people collaborate, aligning with the shared assumptions that guide behavior. So the correct answer here is assumptions about people and how work gets done. Okay. Next is prospective payment systems provide reimbursement that is A, based on actual cost, B, based on changes, C, determined prior to care rendered, D, determined by the number of members served per year.
C, to determine the prior to care.
Okay, very good. It's letter C. So the capitation system involves paying a fixed pre-agreed amount. So for example, if I, as a construction company, contract with an insurance company for an insurance policy for my employees, I'll agree to pay a fixed amount upfront regardless of whatever the service the employees receive are expensive or cheap. So for instance, I agree to pay $10 per employee annually. So if I have 100 employees, I will pay 1,000 annually. Or for 10 employees, I'll pay $100 annually. This is the capitation system. So it means we determine the costs. So before providing the medical service, for example, we determine it based on a set amount, not according to the services actually used by the employees over the year. So capitation is prospective and proactive as it involves determining payment before services are rendered. So the answer is correct. It's letter C. Prospective payment are reimbursement models in which the payment amount is determined before the medical care or services are provided. So this contrasts with retrospective payment systems where reimbursement is based on actual cost incurred or services delivered. Okay? So clear. Determined prior to care rendered. This is the prospective payment system. Okay. 28. The key goal of re-engineering is to A. Improve care processes. B. Satisfy the customer. C. Position for change. D. Redesign the organization.
Improve care
Design the
process.
organization.
Okay.
Mm.
Redesign.
Re-engineering is improve care processes.
Okay. The correct answer is yes, it's letter D, redesign the organization. The key goal of re-engineering is to redesign the organization fundamentally to improve performance, efficiency, and adaptability. Re-engineering focuses on rethinking and radically changing core process to achieve significant improvements in critical areas such as cost, quality, service, and speed. A hospital undergoing re-engineering might redesign its entire patient admission process, integrating advanced technology and multidisciplinary teams to reduce wait times and improve patient experience. So, the answer here is redesign the organization. Okay. Stephen Strong, 60, is recuperating from a total hip replacement procedure following a fall and fracture. He has a history of diabetes and heart disease and had an angioplasty just 2 months ago. He had been fully sufficient until the fall. The hospital has a new transitional care center to which total joint replacement patients are transferred for post-operative physical therapy. The hospital is part of an integrated delivery system serving the community across the continuum of care. Use this information to answer questions. The Integrated Delivery System, IDS, represents what type of healthcare system? A. Subacute. B. Horizontal. C. Vertical. D. Acute.
Horizontal.
Okay. Yes.
Horizontal.
Horizontal. Any other?
I think it's vertical. C.
The correct answer is vertical. Why? An integrated delivery system, IDS, that provides care across the continuum, such as a hospital with a transitional care center for postoperative rehabilitation, represents vertical integration. So in the case of Stephen Strong, the hospital has added a traditional transitional care center to provide post-operative physical therapy, a service distinct from its primary acute care focus. This expansion supports patients in their recovery journey and represents a move into a different level of care, aligning with vertical integration. Okay, so that's the meaning of the vertical integration. Next. Stephen Strong, 60, is recuperating from a total hip replacement procedure following a fall and fracture. He has a history of diabetes and heart diseases and had an angioplasty just 2 months ago. He had been fully self-sufficient until the fall. The hospital has a new transitional care center to which total joint replacement patients are transferred for postoperative physical therapy. The hospital is part of an integrated delivery system serving the community across the continuum of care. Use this information to answer questions. As part of the integrated delivery system, IDS, the transitional care center will best meet Steve Strong's needs through A. Case management, B. continue with physical therapy in the home. C, diabetic disease management. D, home evaluation through occupational therapy prior to discharge.
Home evaluation through occupational therapy prior to discharge.
Okay, any other answer?
Okay,
Okay,
that's it. Home evaluation.
okay. The correct answer here is letter. What's your answer, Doc Nadine?
D.
It's D.
The correct answer here is case management.
Oh.
Why case management is the best option? Because Steve requires a multifaceted approach to care, post-operative rehabilitation of his physical therapy for his hip, monitoring for complications related to his cardiac history and diabetes, and coordination of services across the care continuum. Case management ensures all these needs are addressed cohesively, optimizing his recovery and transition to independence. Okay? In addition to that, case management is a part of managing a patient's condition and involves having a case manager who oversees and ensures proper care coordination. This always means maintaining communication and harmony in the delivery of medical care across all departments. Okay, so this is the correct answer, case management. Next, in an inpatient stay, specific patient conditions that are present on admission and require treatment during the stay are called A, complications, B, comorbidities, C, community acquired, D, healthcare associated.
D, comorbidities.
When a patient is admitted with certain symptoms or conditions, what is this considered? So for example, a patient comes in for gallbladder surgery, but they also have diabetes and and problems and other complications.
Comorbidity.
These additional issues could lead to an increase in the treatment steps or costs. So what is this called? Is it?
Comorbidity.
Very good. It is comorbidities. Okay. That's the comorbidity refers to pre-existing conditions, issues the patient already has when admitted, such as diabetes or heart problems.
Hypertension.
Yes. So these are the conditions the patient carries into the hospital, potentially affecting treatment outcomes. Okay? Understood?
Yeah.
Okay. Yalla. Let's move on. 32. The interdisciplinary team is charged with creating a new admission process that will radically reduce current delays and wait times. The team is looking for A, continuous quality improvement, B, system thinking, C, breakthrough improvement, D, process reliability.
Mm,
To improvement.
Waiting time the team is looking for.
C, breakthrough.
Continuous
Okay.
quality improvement. And
Okay. The final. Okay. The answer is letter C, breakthrough improvement.
oh,
Okay. Breakthrough improvement. The interdisciplinary team is tasked. Interdisciplinary team here is tasked with creating a new admission and process that will radically reduce delays and wait times. So these points, the need for breakthrough improvement, which involves making fundamental, excuse me, radical transformations rather than incremental adjustments. Breakthrough improvement is the correct answer because the context indicates a fundamental transformation, not continuous tweaking of the existing system. So that's the rationale. Question? Clear?
yes.
Okay, proceed. Healthcare quality professionals facilitating the assessment of the impact of the organization's culture on quality should evaluate, at the very least, the organization's degree of compliance with A, the budget, B, mission and vision statement, C, strategic plan, D, policies and procedures. I have here what we call a Gantt style questions, the famous complex type of question that goes in circle. And by the time you have read it, you're not even sure what it's saying. So these Gantt style questions are not the typical exam questions, everyone. So we are just practicing them so that if one or two of this type shown up in the exam, you are all well prepared. So here is asking something like this. As a quality professional, you want to evaluate the impact of the organization's commitment to quality culture. So the impact of the organization's commitment to quality culture and its effect on the quality of the institution. The question asks, at a minimum, the first thing you should look at it is what? What is the minimum or the most basic thing the organization should have? So it is it the
Mission and
policy,
vision statement.
processes, okay? And plans, the strategic plan or the mission and vision, okay? So what's the answer now?
Mission and vision statement. That's
Yes,
the basic.
exactly. That's the correct answer. It's the mission and vision statement. This defines the organization's purpose, goals, and aspirations. So based on this, we then develop our strategic plan.
Strategic
So
plan.
first thing is we have the mission and vision statement. Then we can formulate our strategic
Strategic
plan. Very good. Bravo, bravo. Okay, next. Sunshine Community Medical Center is merging with 3 other hospitals and their IPAs and home health agencies to form the Sunshine Healthcare Network. The new integrated delivery system's vision is to create a seamless continuum of care within the region, represented by their communities. The healthcare quality professionals is part of a team working on the redesign of the quality management programs into an integrated system-wide quality strategy. Consider this scenario in answering the questions. The system-wide merger and redesign best meets the definition of A, restructuring, B, right-sizing, C, downsizing, D, re-engineering.
Re-engineering.
Okay? Okay. The correct answer is D, re-engineering. Re-engineering, the process involved in the collaboration. The process themselves were modified. So this is re-engineering. Okay, so this is the correct answer because re-engineering involves modifying and enhancing existing processes to adapt to new collaborations and goals, which fits the scenarios, okay, on improving the integrating quality systems. So this is the right answer, re-engineering. Okay, next. Sunshine Community Medical Center is merging with 3 other hospitals and their IPAs and home health agencies to form the Sunshine Healthcare Network. The new integrated delivery system's vision is to create a seamless continuum of care within the region, represented by their communities. The healthcare quality professional is part of a team working on the redesign of the quality management programs into an integrated system-wide quality strategy. Consider the scenario in answering questions. The organizations involved in the redesign must each commit to A, preserving their culture, B, incremental change, C, fundamental change, D, their own leaders. What's the
Fundamental
answer?
change.
Hmm?
Fundamental change.
Fundamental change is, yes, the correct answer. The scenario, okay, describes a merger of multiple organizations into an integrated delivery system with the goal of creating a seamless continuum of care. For this transformation to succeed, each organization must commit to fundamental change, as this involves rethinking, and redesigning processes to align with the unified goals of the new system. This type of integration is a complete transformation of processes across the network. So each organization must move away from its siloed operations to adopt a unified system. So that's the rationale. Next question. Sunshine Community Medical Center is merging with 3 other hospitals and their IPAs and home health agencies to form the Sunshine Healthcare Network. The new integrated delivery system's vision is to create a seamless continuum of care within the region represented by the communities. The healthcare quality professional is part of a team working on the redesign of the quality management programs into an integrated system-wide quality strategy. Consider this scenario in answering questions. To create a seamless continuum of care, the Sunshine Healthcare Network will first seek to A. Consolidate locations, B. Integrate financial planning, information systems, marketing, C. Expand technology at all locations, D. Focus on incremental process improvements. What's the answer?
Integrate financial plan. Option B.
What's the answer, Doc?
B.
Okay, so the correct answer here is letter B, integrate financial planning, information systems, marketing. So this means integrating financial planning and information management system with marketing and with all the systems. So we will create an integration among all of this. So for example, in this network, so we have the departments A, B, and C, and D. So previously, each of these departments had separate plans. Now, I will unify them all into a single system that connects all the departments and ties them together. This means I will create a system integration. So integrate financial planning, information systems, and marketing. Okay, let's move on. In the transition from quality assurance to quality management or quality improvement, which of the following emphasis has resulted in the most significant benefit? A. Focusing primarily on processes rather than individual process performance rather. B. Focusing on organization-wide rather than clinical processes. C. Organizing activities around patient flow rather than department or discipline. D. Initiating more prospective rather than retrospective improvement efforts. What's the answer?
Focusing more on process rather than individual performances.
Okay, what letter, Doc?
A.
Okay, letter A. Okay. A hospital notices frequent medication errors. So instead of blaming individual nurses, the quality improvement examines the medication administration process, identifies the flaws, example, the unclear labeling, and implements the system-wide change to prevent errors. So the correct answer here is letter A. Very good. Focusing primarily on process rather than individual performance. Okay. Next, 38. Attempts to align the financial incentives of purchasers, payers, and providers with provider performance on clinical process and outcome measures could encourage A. Underutilization, B. Community backlash, C. Overutilization, D. Reengineering. What's the answer?
Performance on clinical process.
Financial incentives of purchasers, payers, and providers with provider performance on clinical process and outcome measures could encourage what?
Underutilization.
Okay, the correct answer is overutilization. When financial incentives are aligned with provider performance on clinical process and outcome measures, there is a risk of encouraging overutilization. Yes, where providers may deliver excessive services or procedures to maximize financial rewards. While the intent is to improve quality, such incentives can inadvertently promote unnecessary care. Why not underutilization? Because aligning financial incentives with quality performance typically discourages underutilization, as providers are rewarded for meeting process and outcome measures. What about underutilization? This involves providing too few or inadequate services, which is the opposite of the behavior incentivized here. For the community backlash, while financial incentives might raise concerns about cost or fairness, this scenario focuses on provider behavior, not direct community reactions. For the reengineering, although reengineering processes can improve outcomes, this option is not the result of aligning financial incentives. Instead, the scenario highlights how incentives may inadvertently lead to excessive service delivery. Okay, so the correct answer is overutilization. After defining internal and external customers, your organization is making a master list of each type of customer before initiating a major change process. Of the following, which is the best next question to ask of staff? A. Who do you receive service from? B. Who in your work day do you serve? C. Which patients receive your services? D. How do you know a customer from a supplier? So here, okay. So keep in mind the question is directed at the staff. So you'd go to the staff and ask the staff. So who do they serve in their daily work, or who are their
The
primary customers? The question aims
external
to ensure that the staff understands the distinction between internal and external customers. So
customer.
exactly, yes. So exactly, you'd ask them, who do you serve in your work? Who do we as staff serve? So the correct answer would be
External, no, this
letter,
one.
letter
B.
B. Yes, that is the correct answer, B. So who in your work day do you serve?
Yes, sir.
Because after defining internal and external customers, the next step is to ensure staff can identify who they serve during their workday. So asking this question helps clarify their role in the organization's processes and the relationships they have with both types of customers. It emphasizes the customer-centric approach required for successful change management. Okay, clear?
Yes.
Okay. Next, process indicator is defined as one that measures A, significant events that require further investigation, B, an activity carried out to provide care or service, C, unexpected or negative variation, D, the appropriateness of the procedure or treatment. What's the answer?
Process indicator.
Okay, the correct
Carried
answer
out
here.
Activity.
Okay, the correct answer here is letter B, an activity carried
An
out
activity carried out.
to provide care or service. Okay,
The
why?
process.
Because a
It's
process indicator is a measure that evaluates how care or services are delivered by focusing on the activities, tasks, or procedures performed during the provision of care. Yes, so that is the process indicator. Okay. Next. The following is basically reviewed to determine the medical necessity and the appropriateness of service delivery in inpatient care. A. Admission review. B, diagnosis related group or DRG validation, C, procedure review, D, quality audits.
Quality audits. Basically,
Okay, quality
Process
audits.
related to validation.
Mhm. Okay, the correct answer here is admission review.
admission review.
Why?
Mm.
Because it is conducted to evaluate the medical necessity and appropriateness of inpatient care. So it ensures that patients admitted to a hospital truly require inpatient services and that their care aligns with established guidelines and standards. Okay, so that's the rationale. Inpatient settings. Okay. When evaluating how many people in her facility's managed care plan were able to receive the flu shot under dimensions of performance: A, appropriateness, B, availability, C, effectiveness, D, efficacy. What's the answer?
Availability.
Hmm?
Evaluating how many people in her managed care plan.
Okay, the answer is altogether.
Availability.
It's very good. Availability. So when evaluating how many people in the managed care plan were able to receive the flu shot, the focus is on the availability of the service. Yes, so this dimension measures whether the resources, example, these vaccines, the staff, or facilities are accessible to the intended population. So the question is assessing how many people could access the flu shot within the facility's managed care plan. So this directly relates to availability, as it determines whether the organization has sufficient resources to meet the population's needs. So that's the rationale. The answer is availability. Okay? Next question is, a radiology department regularly monitors X-ray, repeat, reject, timeliness of report dictation, and patient waiting times. What component is missing in this department's ongoing evaluation program? A, appropriateness review. B, process evaluation. C, quality control. D, documentation analysis.
Yes, review.
Hmm. Okay, what else? Who else? Who got the correct answer? And who has the answer? Okay, so that's correct. The correct answer is letter A, appropriateness review. Because in this scenario, the radiology department monitors operational metrics such as X-ray repeat, X-ray reject rates. So timeliness of report dictation and patient waiting times. This focus on the efficiency and quality of the radiology process. However, the missing component is an appropriateness review, which evaluates whether the X-ray was clinically necessary and aligned with guidelines for the patient's condition. Okay, so an example in radiology is, for example, the without appropriateness review. For example of this is, a physician orders an X-ray for every patient with mild back pain, leading to unnecessary procedures. What about with appropriateness review? So the department, for example, reviews and identifies that only patients with specific red flags like trauma, fever, or significant neurological symptoms should receive X-rays. So that's the appropriateness review. Clear? Okay, so let's proceed. Zero waste in particular equipment, supplies, ideas, and energy means A, effectiveness, B, efficiency, C. Appropriateness, D. Equity.
Efficiency.
Okay. The correct answer is efficiency. Yes, correct. Letter B. Efficiency refers to minimizing resource waste and ensuring optimal utilization of resources. Very good. Okay, next. Appropriateness of appendectomy. A. Pre-admission test. B. Pathology test. C. Age. C. Clinical test. What's the
Clinical
answer?
test. Clinical test.
Okay. The correct answer here is pathology test. Pathology test. The appropriateness of an appendectomy is determined by confirming whether the surgical intervention was necessary based on clinical and histopathological evidence. Among the options provided here, the pathology test is the most critical step for verifying the need for the appendectomy, because the pathology test, which is also known as histopathological test, involves examining the removed appendix tissue under a microscope to confirm whether there was acute inflammation, infection, or another condition justifying the procedure. So this test validates the appropriateness of the appendectomy, ensuring the surgery was not performed unnecessarily. Clear? Okay. After administration of flu vaccine, quality professional measures how many people or capacity caught influenza after administering the vaccine. Which dimension she measured? A. Prevalence. B. Process. C. Appropriateness. D. Efficacy.
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 Okay. Very good. Bravo. So the answer is efficacy, measuring how many people caught influenza after receiving the vaccine. The vaccine evaluates the efficacy of the vaccine. Efficacy refers to what? The ability of an intervention, for example, the vaccine, to produce the desired outcome, which is preventing the flu. So under controlled or ideal conditions. So the professional evaluates the proportion of vaccinated individuals who still caught the flu, reflecting the vaccine's ability to prevent influenza. Okay, next. A quality manager is determining how many capacity patients still became sick from influenza after receiving flu shots at his facility. Which dimension of performance is he evaluating? A. Appropriateness. B. Effectiveness. C. Efficacy. D. Safety.
Effectiveness.
What's the answer?
Effectiveness.
Yes, correctly. You are correct. Letter B. In this scenario, the quality manager is evaluating the real-world outcome of the flu vaccination. By how? Measuring how many patients still became sick from influenza after receiving the vaccine. So this aligns with the dimension of effectiveness, which focuses on how well a service or intervention achieves its intended results in actual practice. Okay, next. A patient diagnosed with hepatocellular carcinoma is receiving a novel chemotherapeutic agent based on promising preliminary data from clinical trials and the absence of other viable treatment options. The dimension of quality for which the medication was chosen is it's A. Efficacy, B. Effectiveness, C. Safety, D. Appropriateness.
Appropriateness.
Yes.
Okay, answer? The answer is?
D.
D.
The answer here is letter A, efficacy.
Efficacy.
The dimension of quality highlighted in this scenario is efficacy. Why? As the chemotherapeutic agent was chosen based on promising preliminary data from the clinical trials. Okay, so this means the decision to use the medication relies on its potential ability to achieve desired outcomes in controlled settings, which is the clinical trials. Okay, so in this scenario, the patient is receiving a medication based on its preliminary clinical trial results, meaning it has shown potential efficacy, but may not yet have the real-world evidence of its effectiveness. So why not effectiveness? Effectiveness measures the real-world outcomes of a treatment. So this medication is still being used based on clinical trial data. So not widespread real-world evidence. So this dimension is not relevant here. What about safety? Well, safety is always a consideration, but the focus of this scenario is on the potential benefit of the medication based on its efficacy in trials, not on its safety profile. Not appropriateness. Why? Because evaluates whether the intervention aligns with the patient's clinical needs and guidelines. While the medication was selected due to the lack of other options, the scenario emphasizes the use of clinical trial data to justify the choice, pointing to efficacy rather than appropriateness. The chemotherapeutic agent was chosen based on its efficacy, as demonstrated in preliminary clinical trials. That's why this makes letter A, efficacy, the correct answer. Clear? Yes, Doc, clear? Any doubts?
Yeah,
Yes, no doubt.
Okay, so let's proceed. 49. For which aspect of care are patient-reported outcome measures most credible? A. Communication between providers. B. Patient-provider interactions. C. Adherence to clinical practice guidelines. D. Appropriateness of therapy.
Appropriateness of therapy.
What's the
Patient-provider
correction?
interactions.
Okay, yes,
Positive
correct.
aspect of quality.
Letter B is the correct answer. Patient-provider interactions.
Interaction. Okay.
Yes, that is the correct. Because these are most credible for assessing aspects of care that rely on the patient's perspective and experience, such as interactions with providers. Okay, so patient-provider interactions encompasses communication, trust, and shared decision-making, all of which are best assessed by the patients themselves. Okay, so let's proceed. 50. The primary purpose of the survey is to measure A, patient expectations, B, capacity of the process, C, competence of the staff, D, utilization, appropriateness. What's the answer? Primary purpose of the survey is to measure A, B, C, D.
Patient
Very
expectations.
good. That's the correct answer. It's letter A, patient expectations. The primary purpose of a survey is typically to gather feedback or insights from respondents in the context of healthcare. It often focuses on understanding patient expectations or experiences. Surveys are powerful tools to assess what patients anticipate or perceive regarding their care, helping organizations align services with patient needs. Okay. Next, 51. For CQI to be successful, who must be included in the team? A, department supervisor, B, administrator, C, facilitator, D, staff.
Staff.
What's the answer?
Staff. Who must be included? All
Okay.
administrators.
Everyone, it's
Yes.
essential to involve. So the process owner, who is the person most directly involved with and knowledgeable about the process. So for example, if I want to improve the reception department, does it make sense to form a team from various departments without including someone from the reception itself? No, of course. So the process owner must be included. So the process owner is the individual closest to the process and most familiar with it, like the department head or a supervisor from the relevant section. So in here, for example, the head of the reception department. So the answer is letter A, department supervisor. Yes, because the department head in this case serves as the process owner, and they are the key to ensuring effective improvements. Clear? Okay, next. For CQI to be successful, who must be included in staff? A, administrator. B, person performing process. C, quality management representative. Or D, department supervisor.
Again, same.
Process owner.
Person performing the
What's the answer? Letter
B.
B. Yes, bravo. So person performing process or the process owner. For the CQI or the continuous quality improvement to succeed, the inclusion of the process owner means the person performing the process is critical. Why? The process owner provides first-hand knowledge of the workflow, challenges, and potential areas for improvement, making their participation essential for the CQI initiative success. Okay, so you're all both correct. Very good. 53. Who is responsible for quality improvement within organization? A, quality manager. B, frontline staff. C, everyone within organization. D,
Everyone
chief
within the
executive
organization.
officer.
Everyone
Okay.
within the organization.
Very good. Because everyone within organization, quality improvement, QI, is the responsibility of everyone within the organization. While specific roles such as quality managers and executives play a significant part in guiding and supporting QI efforts, successful quality improvement depends on the active participation and commitment of all staff members at every level. Okay, next. Quality and technical performance refers to how well current and scientific medical knowledge and technology are combined in a given situation to produce the best possible outcome. This joint combination is usually assessed in terms of A, appropriateness of therapy and other medical interventions are applied. B, the quality of interpersonal relationships. C, timeliness and accuracy of the diagnosis. D, both answers A and C are correct.
D.
Mhm.
Appropriateness.
The correct approach is to look at both. Evaluate whether the physician provided care based on their medical knowledge in a way that aligned with the patient's needs and whether the care was delivered at the right time. So what is the answer?
Appropriateness of therapy.
Both A and C
The
are
correct. Okay, the correct answer is D. Both
A and
A
C.
and C. Yes, very good. Quality and technical performance in healthcare refers to how effectively current scientific knowledge and available technology are utilized to achieve the optimal clinical outcomes. Okay, so this performance is assessed based on appropriateness of therapy and medical interventions, because this ensures that the chosen treatment align with evidence, so base guidelines and meet the patient's specific clinical needs, while timeliness and accuracy of the diagnosis. This provides timely and precise diagnosis, which are crucial for initiating the correct treatment and avoiding unnecessary delays or complications. Together, these factors ensures that care delivery maximizes clinical outcomes by integrating medical expertise with effective and timely interventions. Okay. Next. Crossing the quality chasm provided a blueprint for the future that classified and unified the components of quality through 6 aims for improvement, chain of effects, and simple rules for redesign of healthcare. The 6 aims for improvement viewed also 6 dimensions of quality. Which of the following is out of these dimensions? Out. So meaning not included of these dimensions. So what's the answer? A, safe, B, efficient, C, effective, D, care-centered.
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 Roa. Bravo. MashaAllah. Yes. Letter D is not included. So letter D, care-centered, because the 6 dimensions of quality outlined in Crossing the Quality Chasm by the IOM or the Institute of Medicine are safe, effective, patient-centered, timely, efficient, and equitable. Okay. Which of the following situations best describes the term misuse of resources at healthcare facilities? A. Patients receive appropriate medical services that are provided poorly, exposing them to added risk of preventable complications. B. Patients undergo treatment or procedures from which they do not benefit. C. Patients do not receive beneficial health services. D. None of the above. Yes.
Patients receive appropriate services that are poorly provided.
Oh, yes. MashaAllah. So the correct answer here is letter A. Patients receive appropriate medical services that are provided poorly, exposing them to added risk of preventable complications. The term misuse refers to situations where the right service or intervention is provided, but it is delivered incorrectly or poorly, resulting in harm or exposing patients to preventable risks or complications. This contrasts with overutilization or unnecessary services and underutilization, which is failure to provide necessary services. Okay. Let's proceed. Okay. So, are there any additional questions remaining from today's sessions? That's the end of our Quality Basics